Hi, my name is Anisha. My number is 0052.
Hi, my name is Putri Iwanina binti Muhammad Rizwan. My matric number is U4250139.
My name is Lima Kairoshini and my matric number is U4250138.
It starts with a cough. Your chest feels tight, your breathing picks up and gets swollen, making you feel short of breath. These are a common symptom of an asthma attack. Around the world, more than 300 million people suffer from asthma and around 215 people die from each year. But why do people get asthma? And how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchus. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, their airways are chronically inflamed, which can make them hyper-responsive to certain triggers. Some of the many asthma triggers include tobacco smoke, pollen, dust, fragrance, exercise, cool weather, stress, and even the common cold. When people with asthma are exposed to these triggers, an asthma attack or explosion can occur.
But how exactly are the factors to an asthma? If an asthmatic is exposed to a trigger, the smooth ring of muscle that circle the small airways in the lung contract and become narrow. Simultaneously, the trigger worsens inflammation, causing the mucosal lining to become more swollen and secrete more mucus. Under normal conditions, the body uses this mucus to trap and clear particles like pollen or dust. But during an asthma attack, it blocks and narrows airways, making it even harder to breathe. This effect leads to the symptoms of asthma. Smooth muscle constriction results in the feeling of chest tightness. Excess mucus and increased inflammation can cause coughing. That happens because as the airway constricts, air viscous as it passes through the narrow space. These symptoms may make a person feel like they are running out of air. Yet counterintuitively, during an asthma attack, the inflammation can make it harder to exhale and inhale. Over time, this leads to an excess of air in the lungs, a phenomenon known as hyperinflation. The trapping of air inside the lung forces the body to work harder to move air in and out of them. Over time, this can lead to reduced oxygen delivery to the body's organs and tissues. Sometimes, in untreated severe asthma attack, the body can keep up, which can lead to death from lack of oxygen.
Asthma can lead to death from lack of oxygen. So how we can prevent uncomfortably and potentially fatal attack in people with asthma? One way is to reduce exposure to triggers. Unfortunately, the world is so unpredictable and people can't be always be avoided. This is where inhalers, the primary treatment for asthma, play an important role. Inhaler help asthmatics both control and prevent their symptoms. They deliver medication directly to the airway, usually as a mist or fine powder, to reduce stress on the lungs. Inhaler came in two main forms. First is reliever inhaler. These provide quick relief and contain beta agonists. Beta agonists relax the tightened airway muscle, allowing the airway to widen so more air can move in and out of the lungs. And second is the preventer. These are used long-term and contain corticosteroids. Corticosteroids reduce airway inflammation and sensitivity, helping keep asthma under control. They also prevent long-term airway damage caused by chronic inflammation such as scarring.
First, shake the device. Empty the lungs and remove the cap. Place the mouthpiece in your mouth and press the canister. Inhale and hold the breath and breathe out slowly.
This is an asthma precaution. Avoid non-trigger. Stay away from smoke, strong perfume, dust, pollen, and air pollution. Wear a mask in a dusty or polluted environment. Number 2. Use preventer inhaler daily. Take your corticosteroid inhaler as a prescribed. If even when you feel well. This prevents long-term airway inflammation. Carry a reliever inhaler at all times. Always keep your salbutamol and blue inhaler with you for sudden symptoms.
Okay, so now we want to talk about cleaning and storage for asthma disease equipment care. Now we want to talk about moderate dose inhaler MDI. We need to remove the metal canister and from the plastic holder. Do not wash the metal canister. Rinse the plastic mouthpiece and cap with warm running water. Shake off excess water and let it air dry completely before reassembling. Clean once a week or more often if clogged. For moderate dose inhaler MDI storage, we need to keep in a cool, dry place away from heat or direct sunlight. Do not store in hot car. Keep the cap on to prevent dust entering the mouthpiece. This is we call spacer or aero chamber. For the cleaning, we need to disassemble the parts, sort in warm water, and might this soak for 10 to 15 minutes. Switch gently, do not scrub as it can create static. Rinse with clean water. Air dry vertically without wiping static, and clean weekly. And for the storage, we need to store in a clean air dry place, not compressed or bent. Keep in a protective bag if traveling. That's all. And last one, for the general care and hygiene, replace inhaler spacers and nebulizers part according to healthcare recommendations. Keep all device dust free and protected in clean containers. Check expiry dates regularly.
A few moments later.